everyone. Welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. Here at Connected Rheumatology, we talk about rheumatology, immunology, diet and movement, and mental health and wellness because we believe it's all connected. If that sounds like something you're into, make sure you hit subscribe, make sure you like this video, share it with anyone you think can benefit from this information. It really helps us out, kind of get in front of more eyeballs, so I'd really appreciate that. Today we're going to be talking about dermatomyositis, what it is, who gets it, what are the signs and symptoms, what do we do about it, and really important about how it's connected to cancer. So I really recommend that you watch this all the way through if you are been diagnosed with dermatomyositis, or maybe that's one of the things you and your doctor are talking about and trying to figure out. All of this information is super important as you kind of start that journey. So stick around, let's get to it. Okay, so what is dermatomyositis? Well, I always like to break up the word because it's right there, right? It's right there in the word. So dermato, derm, skin, and myo, muscle, itis, inflammation. So it's a systemic autoimmune condition that affects the skin and the muscles. And autoimmune leads to inflammation. So this condition, you see inflammation in the skin as well as in the muscles. Now, myositis, just in and of itself, which is muscle inflammation, can be a feature of a lot of different conditions. We see it in a lot of our autoimmune conditions, things like lupus, Sjogren's, mixed connective tissue disorder. So these are things where you can see myositis as a feature of those conditions. You can also see myositis connected to infections, connected to different types of cancers. So myositis is kind of a general term that just means muscle inflammation that can be seen with a lot of different things. Dermatomyositis, however, is a very specific condition that is associated with very specific skin changes as well as very specific findings under the microscope. The muscle fibers look a certain way that really let us know, okay, this is dermatomyositis that we are working with. All right, so who gets it and why? Well, I'll just cut to the chase as far as the why. Like most of my autoimmune conditions, we don't have a firm answer. Again, like in most of my autoimmune conditions, it does affect women more than men, and it really can happen at any point in someone's life. Okay, so what are the symptoms of dermatomyositis? So first off, it is a systemic autoimmune condition that is driven by inflammation. So similar to lupus, similar to rheumatoid arthritis, you're going to have what we doctors call constitutional symptoms, which basically just overall fatigue, brain fog, might have some fevers, just generally feel like crud, which is a consequence of all the inflammation going on in the body. Specifically though, when we're talking about dermatomyositis, skin and muscles, there are some skin rashes that are fairly specific for dermatomyositis. Now, if you've watched any of my lupus stuff, you'll know that with lupus, for example, you can get a lot of different rashes, and in autoimmune conditions in general, sometimes rashes can look different on different people and it can kind of seem like it's all over the place. But with dermatomyositis, there are some rashes that are actually pretty specific for this condition. Okay, so what are they? So first is the Gotrons papules or Gotrons rash. And this is going to be a red, sometimes darkened, depending on your skin pigment color, bumpy rash that happens on the top of your big knuckles of your hands. And we call this, the medical term for this location is going to be the extensor surface of the joint. I know, it's like, who cares? But I say that because it classically can be on the hands, but it can also be on the elbows and the knees because this is the extensor surface of this joint and the knees are the extensor surface of that joint. So you can actually get Gotrons in other places than the hands, but classically we think of it as this red or darkened bumpy rash across the knuckles. You can also get the heliotrope rash, and the heliotrope rash is going to be a red or darkened raised, the swollen area around the eyes. So the entire area around the eyes can be puffy, red, really uncomfortable. You can also get the shawl sign, and this is a red, bumpy, sometimes darkened rash along the upper back, and then sometimes here on the chest we call it the V sign. And it's basically if you're wearing a shawl, like where the shawl would hang. Now, one hallmark of all of these rashes and where they are is that it seems to be related to UV exposure. So sunlight can really bring out these rashes. And then of course we have the myositis part of dermatomyositis, and that's going to be muscle inflammation. And the hallmark symptom of muscle inflammation, at least with this particular condition, is going to be muscle weakness. A lot of times people are worried about myositis or dermatomyositis if they have muscle pain. And although muscle pain can happen, it really isn't the hallmark feature. What we're really looking for is weakness. And it's not just weakness, it's where the weakness is. Which muscle groups are being affected is really key in kind of honing in on this idea that you're dealing with dermatomyositis. So with dermatomyositis, we talk about the proximal muscles being affected. And when I use that word proximal, I just mean the muscles that are closest to the trunk. So we're talking about the upper arms and the upper legs. And so how does this translate to you? Well, this means that you have a hard time raising your arms. So things like combing your hair, even brushing your teeth, reaching to a high cabinet can become very difficult, if not impossible. You get weakness of your legs, you can have a hard time getting up from a chair. Interestingly, a lot of times, especially when the weakness isn't super severe, when the doctor tests the individual muscles, they might actually seem like they're not that weak. And someone might be able to walk fine, but it's really important that you think about and the doctor examines your ability to get up from a chair. Because if you have any inflammation of those upper leg muscles then that's causing weakness, getting up from a chair can be really difficult, and you might have to do a little bit of this rocking motion to get some momentum to get up. So those are really the hallmark areas where you can get weakness from the muscle inflammation of dermatomyositis. Now, in severe cases, you can also have weakness of the neck muscles, which can make it difficult to lift up your head. Part of the esophagus is made of the same type of muscle that your arm muscles are made out of, and so that can get weak, causing people to have trouble swallowing. And in really severe cases, even the diaphragm can have weakness, which can make it difficult to take a deep breath. Thankfully, that's rare. So it's the combination of this weakness seen by your doctor on your physical exam, the weakness that's we can actually see with our eyes and feel with our hands that you're weak in your shoulders and your hips, along with the presence of one or sometimes multiple rashes that lets your doctor know, like, okay, dermatomyositis is like high on my list. Now, of course, dermatomyositis is a systemic autoimmune condition. So aside from the skin and the lungs, you can also have other problems. And one of the problems that we always want to make sure we screen for and that we always keep an eye out for is the presence of lung disease, and specifically interstitial lung disease. All right, so you go in, your doctor's worried, they see the weakness, you have some rashes. How do we confirm this diagnosis? Well, if you land in a rheumatologist office, you're going to get some blood work done. And so we have our blood test. Now, as opposed to some of my other conditions, dermatomyositis doesn't really have a specific autoantibody that nails the diagnosis or really is even commonly associated with the condition. That doesn't mean that we don't check antibodies. In fact, we will probably check all the antibodies whenever we're kind of working this up and trying to figure it out. And part of the reason we do that is, like I said, myositis, just muscle inflammation, can actually be seen in a lot of other autoimmune conditions. And so we're going to do all the autoantibodies looking for things like lupus and Sjogren's and other autoimmune conditions to see if that's maybe, if there's an overlap syndrome or if there's some sort of association, a myositis association with some other autoimmune condition. There's also what we call the myositis panel. And this is going to be a collection of different autoantibodies that are not necessarily associated with dermatomyositis, but can be associated with other types of myositis? Plural, insert plural word for myositis. And you know, the term an autoimmune myositis is a spectrum. Dermatomyositis is one that we have a pretty good handle on as far as what it looks like, what the muscles look like under the microscope, and so it's its own entity. But myositis as a whole is a spectrum, and so this myositis panel of antibodies that we check for are antibodies that are associated with various different other types of myositises along that spectrum. And then, of course, we have muscle enzymes. So when your muscle is inflamed, regardless of the reason, when your muscle is inflamed, the muscle architecture starts to get distorted. And you start to leak out certain enzymes that usually live within the muscle, and now it's leaking out into your blood. And we can see that on these blood tests. And so the muscle enzymes that will be elevated in someone who has muscle inflammation is going to be CK or creatine kinase, aldolase, but also two enzymes, two blood tests that we always get checked when we check our liver because they're also seen in the liver. It's called the AST and the ALT. Those, however, are also made in the muscle. And so when someone has muscle inflammation, you will have an elevated AST and ALT. And this is super important because oftentimes we will look at those numbers and miss the fact that it's actually coming from the muscle and be too focused on, oh my goodness, the liver is inflamed. And so it's really important that you understand that AST and ALT, yes, they come from the liver, and because myositis is reasonably rare, most of the time you have an elevation of your AST and ALT, it will be from the liver. But if you're having any rashes, if you're having any weakness, and you have an elevation of that AST and ALT on your blood work, then it's important to also consider that it could be coming from the muscle. Okay, and of course we do the basics like looking for anemia and making sure the kidneys are healthy. So once we do our labs, then we want to basically take a picture of the muscles. Like we might see weakness, but we want to see what's actually going on in the muscles because someone might be weak from other things aside from muscle inflammation. And a really good example of that is polymyalgia rheumatica. And if you're interested at all in that condition, I have a whole other video on that, where those people will also have weakness, but it's not because the muscles are inflamed. So we want to get a picture of the muscle. And how do we do that? We do that with an MRI. So it's very common when someone's being worked up for dermatomyositis to get a muscle MRI. And we're going to do an MRI of the muscle that's most affected because we want to get the most bang for our buck. We don't want to take a picture of a muscle that's really not that weak because we're most likely not going to see that much. So you want to get a picture of the muscle that's the weakest. And for most people, that's going to be the thighs. So once you get that MRI, and let's say it confirmed that there's muscle inflammation. Again, it's not specific. All it does is show us that the muscle is inflamed. It doesn't tell us why it's inflamed. The next step is to then do a muscle biopsy. The muscle biopsy is where you get a little piece of the muscle and you can send it to the lab where the pathologist will look at it under the microscope, and there are fairly specific findings that they will see that yes, confirms that this is dermatomyositis. I would be living in fantasy land if I didn't acknowledge that in some cases people can move forward, have a diagnosis of dermatomyositis without a muscle biopsy. And there are a lot of different circumstances and different reasons why this might be the case. For example, if someone has the classic skin findings, classic gotrons, heliotrope, classic muscle weakness, classic positive muscle enzymes in the blood, then a lot of times doctors might choose to move forward with treatment even without a muscle biopsy. This idea being, if it walks like a duck and quacks like a duck, it's a duck. Another circumstance is sometimes it's not always feasible to get the muscle biopsy. Muscle biopsies can be performed by neurosurgeons, by general surgeons, sometimes even interventional radiologists, but it does require a certain clinical environment to get it done. And not everyone has access to that clinical environment. So sometimes in those cases, we can move forward with treatment even without the muscle biopsy. So just something to keep in mind. And then also, just a side note, speaking of biopsies, what about a skin biopsy? We have all these skin rashes. What about a skin biopsy? And sometimes we do them. And sometimes they can give us some beneficial information, but it's not really where the money is, which is why we go for the muscle. Okay, so how do we treat dermatomyositis? Well, we really, with this condition, really rely on prednisone. Unfortunately, prednisone is still the fastest, most effective way at calming down the muscle inflammation. And I hate to say it, but a lot of times we end up having to use doses that are higher than we want for longer than we want. We also have various other medications at our disposal. Some are pills, some are infusions, and kind of beyond what I wanted to get into in this study, or sorry, in this video. But we really start with prednisone to cut down that inflammation. I really wanted to spend some time talking about the connection of dermatomyositis and cancer. This is super important that everyone understands, especially if you or a loved one are dealing with this condition. So there is a known association between the development of dermatomyositis and cancer, specifically ovarian cancer. Now, I say the known, it doesn't mean everybody gets it, but it is important that if anyone has a new diagnosis of dermatomyositis or has a significant flare of their dermatomyositis after being good for a while, that you actively look for the presence of cancer, specifically ovarian cancer. So how do you do that? Well, we do that with pelvic and transvaginal ultrasounds. Ovarian cancer is truly, well, it's truly a B. And it's hard still to get a diagnosis of ovarian cancer early. And so because of this known association, we are very aggressive at looking for it. So what does that mean? That means that when you get a diagnosis of dermatomyositis, that you will automatically get set up to do a pelvic or transvaginal ultrasound, and you should have one once a year for at least the first 5 years. What about other cancers? Well, I don't know if it's really controversial anymore, but sometimes it can be controversial about like how aggressive to be when looking for other cancers. So some doctors will opt to do what we call a full body scan. So head to toe CT scans, just looking for anything. Other doctors will prefer to be a little more targeted in how they're looking. So that means with some labs, a chest x-ray, and again, that pelvic ultrasound. And what direction you go really is based on the discussions you have with your doctor. All right, so what can you expect if you have a diagnosis of dermatomyositis? So dermatomyositis can be a frustrating disease. The muscle inflammation can be taken care of reasonably quick, but you need to be on prednisone in particular, but you need to be on medications longer than a lot of people like. And skin stuff can actually take a lot longer to resolve than even the muscles. In fact, studies have shown that on average, people will struggle with some skin issues for about 5 years, even on treatment. The thing about dermatomyositis and what can make it so frustrating is the muscle inflammation is reasonably easy to control with prednisone. And of course, you have to deal with all the side effects of prednisone, which if you want to know more about that, I have videos on that. But when a muscle has been inflamed and that muscle architecture has been disrupted, the muscle is now weaker than it was. And even once the inflammation is controlled, the muscle you have left is just not as strong. And so weakness can sometimes lag behind inflammation, meaning you go and see your doctor and they say, oh, your inflammation's so much better, but you're still weak. Well, why is that? It's because your muscle has had some damage done. We can do something about that with physical therapy. Physical therapy is integral to the treatment of dermatomyositis and really to any type of myositis. And it really should be started on day one. Maybe not like day one, because if you feel like crud, who wants to go to physical therapy? But like as soon as you start feeling better, you need to be seeing the physical therapist and having a plan and doing your exercises so that you can rebuild the muscle that the inflammation has caused to atrophy or to lose. So that's all I really wanted to say about dermatomyositis. Of course, there's always more I can say. I kind of glossed over all the various different treatment options, but there are some aside from prednisone. But I hope you found this useful. Dermatomyositis is a reasonably rare condition, but again, if you happen to have it, it can be obviously life-altering and confusing and isolating. So I really hope that this provided a little bit of information and comfort and maybe some nuggets for you to think about and take to your own doctor and kind of continue the conversation. If you like this video, please give it a thumbs up, subscribe, share this with anyone you think can benefit. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because we believe it's all connected. Thanks, and we'll see you next time.